Families impacted by Texas Children's Hospital layoffs are concerned for their child's care. They say they're left in limbo with no clear way forward. Last week, the hospital announced 5% of its workforce, which is about 1,000 employees, were cut. The jobs range from nurses, urgent care employees, therapists, and non-healthcare employees. The hospital said the layoffs should not impact patient care, but we're hearing from parents of children who say otherwise. John's oldest daughter has autism and receives treatment at TCH. John is here with us this morning to talk about the impacts these layoffs are having on his daughter and his family. John, thank you so much for joining us.
Thank you for having me.
I understand your daughter's speech pathologist was laid off. What have you been told?
So we originally got a phone call on Tuesday, which was the date of her last appointment, and we were just told that the appointment was canceled. And it wasn't until Friday afternoon, close to close of business, that we were called and told that she would be put on a waiting list now moving forward.
What does the type of therapy she receives at TCH, what does that therapy mean to her and to you?
It's been so important to our family, and I know so many families that receive services there at Texas Children's. When she got her diagnosis, as a parent, there was so much that we just didn't know what to do, how to help her. And so these therapists have been so important to us as parents, and it's been critical in her development. When we first started going, I mean, I couldn't even put her down in the lobby. She would immediately start crying from being overstimulated. And now she looks forward to going. She knocks on the door.
She walks right in.
Yes, she loves her therapist. And one of her first, she has a few words, and one of her first words was hug, and she hugged her therapist. She loves her therapist, and so this is heartbreaking for us as a family. And we really do see her therapist as part of our family.
Absolutely, absolutely. What will you do now? Will you go to another network?
Yeah, my wife and I are considering all our options. I mean, we've been trying to see what options we have through Texas Children's. That was what they did. They provided us a list of resources, but like I said, when we asked for a timeline for the wait list, they weren't able to provide one. So we are going to consider all of our options and might have to seek outside care.
Being in this state of limbo, what is your concern right now?
That her progress, I mean, this is such a critical time for her. I mean, early intervention is critical when dealing with these kids with special needs. And so just not being able to continue that progress during this critical time is what we're most concerned about.
We're saying up to 1,000 employees were laid off. Of course, the ripple impact that this has on the larger community spans well into the thousands when it comes to patients. Have you been able to talk to other parents dealing with similar situations?
Yes, and it's so difficult. I mean, I spend multiple hours every week in the therapy office out of the TCH campus, and I see these parents every week. And like I've said, it's not just when we're in there every week regularly interacting, and we really start to get to know everybody. And so now I worry for all those other families that were relying on this care, commuting from different parts, I mean, all over the Southeast Texas region, that now aren't going to be able to get that care.
And depending on the situation, the ailment that the child has could be really detrimental.
Absolutely.
Talk to us. Has there been any explanation given to you or your family as to what's behind these layoffs?
No, and I feel like that was the hardest part for us, was the lack of communication. And I just feel like we were given no warning. There was no transition plan. I mean, as you can imagine, for a little girl with autism, establishing those relationships with a therapist, it's a time-intensive process. So I was disappointed that we were given no advance notice that this was going to happen and no transition plan moving forward. Like I told you, we waited for several days just to hear what the plan was moving forward, just to be told that we were going to be put on a wait list. It was very disappointing.
And again, you're not sure how long that wait list is. It could be days, weeks, or months.
Right. Yeah. I was told that there was no timeline for how long that wait list could be. And I know demand is incredibly high, and with the amount of cuts that they've made to the staff there, I anticipate that the wait list is going to be a very long time.
As a family, have you decided on how much time you're going to give yourself until you go to another network to start treatment?
You know, we're not going to wait too long. It's because this, like I said, this time is incredibly critical. So we're going to wait a few weeks, see what we have to do. She will still be receiving other therapy services through Texas Children's, but our trust has been, you know, definitely impacted by these changes that are affecting our daughter.
What is your message to TCH?
I just want accountability, and you know, I understand that sometimes these decisions have to happen, but it could have been done better. Improve these processes for the next time, and improve communication with the families so that we can reduce the impact on the kids, because we have to put the kids first, and the impact is significant to these kids, and they're our most important and vulnerable population. We have to take care of them first, regardless of what business decisions are going on.
Yeah. It's always been about the kids.
Right.
And always needs to be about the kids.
Absolutely.
John, thank you so much for your time this morning.